Now we're going to talk about the health insurance exchanges, one of the more innovative aspects of the Affordable Care Act. It gives individuals the opportunity to shop for the health insurance program they want. So health insurance exchanges, or healthcare.gov, are meant to cover two main groups of people. One are the 16 million Americans who got their health insurance through the individual insurance market. Not through their employer, but they alone bought coverage from a private insurer, where they didn't have a lot of leverage and they were subject to many arbitrary rules. In addition, there are about 20 million uninsured Americans who will be able to buy their own coverage and fulfill the individual mandate in the exchange. So that's about 35 million Americans alone who could actually buy coverage in the exchange. Now, people mean a lot of different things by the exchanges, and one way to understand them is to realize that the term is used in two different ways. First, and probably most importantly, the health insurance exchange is a marketplace. It's a marketplace where individuals go and purchase online what kind of health insurance they want. It is a way to compare private insurance plans and allow customers to shop for the plans they want. It's kind of like Zappos or REI or your favorite web shopping site for health insurance. The exchange is also used in another way, which is that's the entity that actually organizes the online shopping experience, that regulates the insurance companies that offer plans in the market, that ensures individual customers are actually catered to and are actually get good choices. Now, those exchanges in the Affordable Care Act were to be run on a state-by-state basis. The Act actually decided not to have a national exchange, but to have exchanges done by the states. In fact, the bill provided financial incentives for states to study the exchanges and to set up their own state infrastructure for the exchanges. The bill envisioned three different ways that the exchanges could be run. First, they could be run by individual states. States could also partner with the federal government and run them in a partnership. And third, those states which didn't establish an exchange, didn't think they could do it, they could defer to the federal government and have the federal government opt out. The theory is that most states would want to run their own exchanges. It turned out to be different. 17 states have decided to run their own exchanges. Most of those states, ironically, democratically controlled blue states. 7 states are running an exchange in partnership with the federal government, states like Arkansas and Illinois and Iowa. But 27 states have decided that they're not going to establish their own state exchanges and have defaulted to have their state exchange run by the federal government at healthcare.gov. Now, the idea is that in the exchange, like in employer-sponsored insurance, there will be a period of open enrollment before the new year. And it's during this period people can go on the website and look at various options and decide which health insurance works for them. And then they have that coverage for the next year, unless something important happens, like they have a baby, or they change jobs, or they move states. On the exchange, healthcare plans are organized into tiers, 4 tiers. And these tiers are actually ranked by how much of healthcare costs they cover. So at the bottom level are the bronze plans, and they cover about 60% of anticipated costs. Then there are silver plans that cover 70% of anticipated costs. Gold plans cover 80%. And at the top end are platinum plans that cover about 90% of anticipated costs. In addition to the 4 tiers, there's a special tier for young people under age 30 to induce them to buy insurance, and that's a catastrophic plan that covers only really big health problems, accidents, or major surgeries. Now let's try to delve down into the different tiers to help you understand how these tiers work. Let's take a 26-year-old individual earning about $23,000 in New Jersey. Turns out that that person will have a choice of 31 different health plans from 4 different insurers. At the very lowest level, there are 2 catastrophic plans, and the lowest monthly premiums, $48 per month. At the bronze level, covering an anticipated 60% of healthcare costs, that individual in New Jersey would have a choice of 9 different health insurance plans, with the lowest monthly premium being about $80. At the silver level, there are 11 different health insurance plans, and the lowest premiums $113 per month. Finally, at the gold level, there are 7 different plans being offered to the individual, and the lowest monthly premiums $163. Now, in the Affordable Care Act, if an individual has to buy health insurance, and health insurance is very expensive, you can only require people to buy an expensive product if you help people who have low incomes. And so there's something called premium subsidies. These are subsidies that allow individuals to buy health insurance when they're too poor to afford it on their own. These subsidies are linked to individuals' insurance. They begin for a family of 4 at roughly $32,000 per year and increase to a roughly $95,000 for a family of 4. All the families in between will get an subsidy. As you can see in this graph, the effort is to reduce the price that people see of health insurance so it is affordable. Prior to the Affordable Care Act, young people or families with small amounts of money would have to pay up to 50% of their income to get health insurance. With the Affordable Care Act, in the exchanges and with subsidies, it's an attempt to cap how much people will pay for insurance, to keep the total premium under 10% by the time families of 4 get to $95,000 of income or an individual gets to $46,000 of income. It's an effort to make the insurance premium affordable. And you can see it makes a pretty dramatic difference in how much a family or individual has to pay over time. As I mentioned, premium subsidies are scaled by people's income. They're also geared to the second lowest cost silver plan in an exchange. That is a very important benchmark because the subsidy allows individuals to choose a bronze plan, and it would cover a bronze plan, or the lowest cost silver plan or the second lowest cost silver plan. They are meant to keep the total amount of premium a person or family pays affordable to the second lowest silver plan. So to give you an example, if you're a single person and your income is $17,000 per year, the government says no more than 4% of your income should go to health care. That's about $700 per year or $57 a month. So this is the way it works. Say the cost of a health insurance plan at the second lowest silver plan is $250 per month. And the government says the maximum you should pay is $57 a month or 4% of your income. That means the premium subsidy would be $193 per month, limiting how much you would pay to no more than 4% of your income. Premium subsidies are an essential way of getting individuals to be able to afford health insurance and get their coverage. The exchanges are complicated, but the good thing is they're a marketplace where individuals get to choose their own private health insurance, and those Americans who have a relatively low income get subsidies from the government to help them purchase that insurance and keep it affordable.